This is an extremely important video for anyone contemplating an aesthetic procedure, getting them currently, or doing your own treatments at home. Let's dive in.
I'm not running around pretending I'm natural because we all know I'm not. It's all fake. Anyone can look like this if they want to. I've got my lips done firstly when I was 18. I got it done because I hated my lips. I was kind of shocked at how much better I felt.
You hear that? It's fascinating. Anyone can look like this if they want to. And that is the perception of society now. And certainly money does help people look like that. She also started at 18. This is very common. And we have 18-year-olds call the office all the time. I limit my practice to 21 and above. But 14, 15, 16, this is where it's trending.
Social media influencer Mitch Greer started her cosmetic injectables journey with dermal filler, a gel-like substance that adds volume and definition.
I've had filler in my cheekbones. I've had filler in the apples of my cheeks. I've had filler in my under eyes. I've had filler in my chin.
Mitch also gets regular injections of Botox.
So she's had filler and Botox, but right away that adds up to probably 5 to 12 vials of filler or 12 mLs in her face already. She obviously is pretty young. You guys out there, I know what you're going to say because you always say it. She doesn't need it. You see where I always say they want it. Nobody needs aesthetics.
A toxin that relaxes muscles.
It was something you heard about in Hollywood. Now, in the suburbs of Sydney, everyone's doing it.
By the way, when you watch that, do you see that picture there? She's getting her masseters injected for facial slimming. Very common amongst influencers because they want that Korean beeline look. It's all about facial shaping. You can see the needle right there. That's masseters. She's young, so she won't get the jowling. She'll get tightening of the skin around it. As we get older, you can't do it, but goes to show how attuned influencers are. And if you're an influencer, you almost need, quote unquote, to be doing aesthetics. Check out your feeds today.
It's become so common that getting Botox or dermal filler can be as easy as going to your local shopping centre. Experts and consumers have told a 7:30 investigation that risks, while rare, are poorly understood.
It's not Coles, it's not. You need to spend money if you want to look good and you need to be safe.
So you got the re-report, yeah? I think the important thing is for this to be understood as a medical treatment. It is not getting your nails done.
I can fit here.
So key, you guys. It is a medical treatment. You don't know how much studying great injectors do. Anatomy courses, learning like ultrasound you're going to see in a minute.
And feel crunching noises when I blink. It's absolutely disgusting and it echoes into my nose and into my ears.
I can understand why as well.
Yeah.
Lisa Grove has travelled from the US to Melbourne to have her filler dissolved by radiologist Mobin Master.
It's way less expensive in other countries. I'm from Canada, New Zealand, Australia, to get scans done. The US is one of the most expensive healthcare providers, countries in the world. And that's why you see people go to other countries. It's crazy expensive in this country to get a scan.
She started getting cosmetic injections after cancer surgery.
The transplanted skin does not match up in height. There's actually a significant height difference. And so it was actually recommended to me to get filler.
Lisa liked the results until a disastrous appointment almost a year ago.
While I was still in her chair and my face exploded out in all which directions I was absolutely unrecognizable even to myself.
So it should be around there. There should be some.
That's an ultrasound right here. Now, what they're doing is locating the filler so they can pointedly dissolve it, as opposed to just putting a bunch of dissolver all over the face. This is a good use of ultrasound. Some people say, now this is a money grab. People want to teach people how to do ultrasound. They say it will prevent cases of blindness. We'll go through that in a minute. But ultrasound, in my opinion, with the technology today, you can't ultrasound people before you get your fillers, because a lot of the vessels that are at blame or to blame for blindness and occlusions are tiny, and there's something called spasm of the vessels. It's not just occlusion of the vessels, it's spasm, particularly unique to hyaluronic acid filler. That's why that is one of the most dangerous forms of filler, in my opinion.
Dr. Master uses MRI and ultrasound to find and reverse past treatments. He can see there's filler behind Lisa's eye.
Look up, yep, that's below globe. There you go, there it is, there it is, there it is.
There's an area of lucency, and they'll get the needle, and they'll, with the ultrasound guidance, let's see if they if they keep the ultrasound on while they get it, or they might not show it. Might be a little too much for you guys to see.
He's using an agent to try to dissolve the substance.
Okay, keep very still for me.
This is hyaluronidase.
How does it feel now?
I'm not feeling the crunching, and it doesn't feel like a rock under.
So it's rather immediate, okay? So you will get an immediate effect. That's how quick this works. Final results certainly can take days, but this is real.
The right eye anymore.
I get chronic issues every week. 50% of my work is reversals. Often a lot of these injectors are not aware on how to dissolve, or they don't have the expertise.
So common. I would say 80% of injectors out there are not trained appropriately.
Risks from injectable procedures range from cosmetic to acute.
If you inject accidentally into a vessel and that vessel gets plugged up by the filler, then everything upstream of that vessel is now no longer able to get oxygen. Then the skin, beyond that blocked point has a very critical period of time, usually 24 to 48 hours before it starts dying. And
every great injector will have an occlusion because it's a numbers game. You cannot see these microvessels. Like she said, the product can go in the vessel, but also it doesn't have to go in the vessel to cause spasm and occlusion. In surgery, you can clamp off the vessels, you don't have a problem, but filler, for a unique reason, creates a unique problem. Filler.
there is a very rare but real risk of blindness from that.
The Therapeutic Goods Administration told 730 it's received 12 reports of blindness related to dermal filler over more than a decade.
So this is in Australia, from what I'm gathering here. 12 reports in Australia. Of course, the US has many, many more.
Only 3 of those patients fully recovered their vision. In the same time frame, there's been 25 reports of necrosis.
That's way underreported. Take the USA, there's at least 5 cases each day because people reach out to me for problems all the time. They direct message me, what do I do about this and that? We have a pretty big training network. 25 report, and of course that isn't the USA, but I'm just telling you, there's many every day.
The death of skin tissue.
Consumers are sold the lie that it's no big deal.
Hi, Cynthia. Come on through. How are you? Good, thank you. Come on in.
I think it's really, really important to look at the qualifications of the person that you are going to.
Let's do some baseline photos. Sure. See how we're going.
Doctors, nurses and dentists.
See how she's getting baseline photos? So many of you that reach out to me for problems send me these cocktail photos and have a drink in your hand and what do I do and all these things. A great practitioner is going to start the appointment with your consent forms and your photos. That's the template for everything.
Can legally perform cosmetic injections, but there's no specific training required before they pick up a needle. No single body regulates the industry.
Same in the United States. Can you imagine? You know what happens in the face, how important that is to you. It's complex. So we're doing these trainings, teaching cadaver anatomy courses. The amount, obviously, of muscles, fat, and the layers in the face, and that fact that there's no general certification required. None.
But the Australian Health Practitioner Regulation Agency told 730 it's investigating 255.
Look how good she is. She got images straight on with facial expression. Key.
Of complaints related to cosmetic practice, including surgery.
Just about anyone with basic qualifications, i.e. they're an upper registered nurse, doctor or dentist, can do a day or 2 days or a week-long boot camp and then essentially set up shop. This is not something that any of us should be taking lightly.
I started getting injectables at 18, so I would look on girls on
Another one, 18.
Instagram and who had perfect skin, perfect looks,
And you don't think social media creates some of this? Look at all of my posts. We talk about that. She's demonstrating to you right there. A lot of people are bereft of the knowledge before getting this.
I was like, I want to look like that. Honestly, I had no thought into it. I just went to any clinic, whatever clinic there was that was doing lips at the time.
The ubiquitous nature of facial fillers.
Marissa Batty has been getting fillers for 8 years, moving between clinics around Sydney.
I went into a clinic to get lip fillers, and a couple of hours later, it bruised up.
You see that? You see the white area? That's necrosis. Now, interestingly, it's in the midline. You have blood supply from the right and the left. This is a very vascular area. But look at that. You have these penumbras, these kind of umbrella regions that have, uniquely to all of us, a paucity of blood flow. Even though anatomically this should not occur, anatomy's varied in all of us. That's how complex this is, but that shows you that's absolutely occlusive. You don't even need to test it any further.
Then started to swell. Looking in the mirror, I remember thinking, like, what is going on? No, it was really confronting.
See what she said also? She went to just about any clinic. The ubiquitous nature of facial fillers is a proclivity towards going to the lowest priced place, and often that's the worst thing you can do.
Hi, how are you? Good, how are you?
She messaged an acquaintance for help, Larissa Danoon, who works at a different clinic.
I was pretty switched on to figure out it was probably a vascular occlusion. Marissa then came into my clinic. We ended up dissolving the area and then continually monitoring. She's very lucky because it was at the early stages of it, but if it had been left for, a couple of days, it would most likely have ended up in a bit of an ugly scar or necrosis even.
That one did look that way. You know what's interesting here is she didn't even get taken care of by the initial clinic that did the work. She sought treatment elsewhere. Often that happens.
So that the skin is very healthy now.
People lose confidence in their own injector. So please be safe. You get what you pay for. Do your research. And when you go to the clinic you choose, watch everything they're doing. If they're following the regular patterns of medicine, because this is real medicine, likely you're safe. We also have a locator, store.rajaniMD/locate. Those are places that carry my products, and you can find clinics on that locator. If they're carrying my products, they may well be within my training circle or offering similar services like PRF All Natural Treatments. Now you want to watch this video on 8 treatments you should avoid ever getting. Keep your skin and body beautiful, healthy, and vibrant. Comments below. I answer them.